Reducing central line infections is among Blessing Hospital's most successful initiatives to improve patient safety. Blessing is a regional leader in patient and family-centered care, and as the largest hospital in Western Illinois, serves patients in 3 states. Recently, the hospital implemented IHI's Central Line Bundle and then incorporated their checklist into each patient's electronic medical record.
A lot of our changes first started on paper, and then we implemented the electronic health record. So how do we take these processes that were dependent on maybe a piece of paper taped to a central line container, and now put it into a computer system that has the reminders of the steps in the process that need to take place, and that doesn't allow the human to fail.
The medical record has built-in prompts, and the checklist that we use includes all those critical activities, starting with hand hygiene, the use of the full body drape, the sterile technique, the antiseptic, and educating the patient and family.
Well, what's nice about the bundling is that everything's together and sterile. It's standardized for everybody. Then everybody knows where everything is, what to do, where to get it, and so that for everyone makes it an easier, simpler, safer procedure.
As the campus and its offerings have grown, leadership at Blessing has focused on quality as a vital metric.
If you sat in a board meeting 10 years ago, you would have heard a lot more about finance and other elements of the business side of the operations. And today, when we look at the value of our service, it is about quality, because then it translates to the bottom line. And we've been able to show how successful we can be by delivering this quality product to the community and building community loyalty.
Blessing's history is closely tied to the city of Quincy, an important economic hub in west central Illinois, and at one time the 3rd largest city in this state. When the hospital learned its rate of central line infections was higher than the national average, leadership mobilized to integrate new procedures. Doctors and bedside nurses began to use the bundle. And then, as they started to use it in conjunction with the electronic medical record, infection rates fell.
And now with data and information, staff can see the results of their work. So what we're doing, is it making a difference? But in addition, we can create solutions or look at how we solve the problem in a more effective way.
We shared results, and I think that's very important. Our critical care committee got the results of the line infection rates at their meetings, and it was shared with the medical staff. And when we had a long run of months with 0, that was celebrated in the organization.
We had a Sweet 16 party when we reached a 16-month period with no central line infections.
Carlene Orton, Blessing's infection control coordinator, works closely with Dr. Robert Merrick, the medical director for quality, examining graphs for evidence of continuous improvement and identifying whether blips on those graphs are cause for concern.
So it's been a process of introducing changes and then measuring them, and then thinking, well, how can we make sure that it happens every time for every patient? And it seems like the more structure we have, and again, having that structure in those electronic medical record screens really help us to be consistent.
We've been very fortunate to be able to coordinate infection rates with standardization of practice. Infection control has been instrumental in helping us keep that data. Dr. Merrick has also been very instrumental in ensuring that physicians understand the importance of maintaining compliance with the bundle as well.
My favorite thing is to see the graphs going in the right direction.
The team coordinated the project's needs with the hospital's IT department to create a computer protocol that prevents mistakes.
Removing human error components of this, you just keep elevating your patient safety.
The patient is the center of everything that we do, and when we take a look at what an infection might mean to that patient in the hospital, whether it's added time in the hospital, added medications that they need to participate in taking, they are all challenges. And I look at all of the learning that has gone on and the science behind it and what we're able to do for patients today. And I find it exciting.
Learn more at blessinghealthsystem.org.